Right. So for the next fetal anomaly which we'll be discussing, this is what is known as what anencephaly. Okay, so you guys should actually notice a trend. For most medical conditions, if they put A, all right, A before something, it shows that there's an absence of that thing, or that thing is very small. So anencephaly just have to do it. Somebody's skull line is supposed to be like this, but the person's skull line is very small. See, can you see this baby's head was supposed to be as big as this? Do you understand? But the head is very small. So it's just it's a severe birth defect. We call it severe because how can somebody like this survive properly? All right, the brain tissue is reduced, the skull mass is reduced. All right, so this is where a baby is born without part of the brain or skull. So it's classified as what? One of the examples of a neural tube defect, meaning it arises from what? Improper development of the neural tube. All right, that one will shed more light when we start talking about embryology, development of babies and all, but for now you could just know it at that level. Okay, so what happens in anencephaly? Right, the neural tube fails to close at the top. That's the cranial portion of the neural tube. This around when your baby is like week 3rd or week 4th, of growing, so it leads to what? Because it fails to close, absence of the forebrain and cerebrum. These are very important parts of the brain that when you are talking about the neuroanatomy, you talk about the functions of different parts of the brain, and those parts of the brains are very important for you to think, for you to be conscious, for you to coordinate. Now can you start seeing the kind of problems that individuals with anencephaly will start having? Of course, when we talk about the functions, that the tissue is not there, so there will be the dysfunction. So the remaining brain tissue is often exposed. All right, so lack skull and skin coverage. All right, so things could even be settling on your brain, bacteria, infections. So key characteristics: such babies are blind, they are deaf, there's no awareness because there's no forebrain for them to coordinate, to stay conscious. All right, so there's no ability to feel pain. Reflex actions like breathing may occur if the brainstem is present. Almost always fatal. So most babies, they just die within few hours you give birth to them. Risk factors: what will make a baby have this? Yes, we said neural tube didn't actually develop properly, but what could actually make the neural tube not develop properly? Maybe the mother, when she was pregnant, she was not taking enough folic acid. So folic acid supplementation is a thing in pregnancy. All right, the mother had diabetes mellitus. She was taking some drugs, so the side effect of those drugs affected the baby. Anti-seizure drugs like viporic acid. All right, maybe it's just a genetic thing, or maybe there's just a family history of anencephalies here and there. Maybe she was exposed to high temperatures during time in pregnancy. So diagnosis is prenatal ultrasound, just before you even give birth to the baby. You're doing an ultrasound to actually look at how this baby is in utero. So also, if you check for alpha fetoprotein levels, if they are high, it's a problem. You can also do amniocentesis, where you take out 1 or 2 amniotic fluid to do the testing, then fetal MRI just to confirm. So there's no cure, but just supportive care offered to the families to cope and say goodbye, because the baby will just always die. So most pregnancies in anencephaly, though, they end in miscarriage, or you just give birth to the baby is already dead. That's stillbirth. Okay, so that's it.